Our group's going to be palpating the hip and pelvis, and I have the anterior portion, which consists of the pubic symphysis, the anterior superior iliac spine, the anterior inferior iliac spine, the sartorius, and the rectus femoris.
For the medial pelvis, we'll be palpating the adductor group, which includes the adductor longus, the adductor brevis, and the adductor magnus.
For the lateral palpations, we will be going over the iliac crest, tensor fasciae latae, iliotibial band, gluteus medius, the greater trochanter, and the trochanter bursa.
I'll be doing the posterior palpations, the median sacral crest, posterior superior iliac spine, gluteus maximus, ischial tuberosity and bursa, hamstring muscle group, piriformis muscle, and sacroiliac joint.
First, I'm going to palpate the pubic symphysis, so I'm going to start on her navel, and then I'm just going to palpate inferiorly until I feel the firm ridge of the pubic symphysis. Next thing I'm going to be palpating is the anterior superior iliac spine. So if I just place both of my hands on the sides of the patient on her waist, my thumbs will kind of naturally fall on two bilateral bony prominences, and these are also known as the ASIS. So for the AIIS, that's the anterior inferior iliac spine, and that's slightly inferior and slightly medial of the ASIS. So it'll be about right there. Next thing I'm going to be palpating is the sartorius, which originates at the ASIS. So I'm going to start at the ASIS, and then I'm going to move and palpate medially and distal to the knee for the sartorius. And then for the rectus femoris, that starts at the AIIS. So I'm going to find that. I'm going to start here. And the rectus femoris runs along the anterior thigh, and it attaches distally to the knee in the vastus group.
We're going to be palpating the adductor muscle group, which includes the adductor longus, adductor magnus, and adductor brevis. So you're going to have your patient lying supine on their back, and then have them flex their hip and slightly rotate it laterally. Then you're going to have them resist and try and move their leg in, and you'll place your hand in the medial thigh, and you'll be able to feel the adductor group tensing up.
For the first palpation we'll be doing is the iliac crest. You're going to start off by finding the ASIS, which is where the hand naturally finds its placement at the hip. Then you're going to work superiorly up the curvature of the bone until you find the bony prominence at the top. Up next is the tensor fasciae latae. We're going to start at the ASIS and we'll work superiorly and distally from there. Then we're going to ask the patient to immediately rotate their hips, and you should feel the tensor fasciae latae stick out. From here, if we keep working distally down, the tensor fasciae latae will turn into the IT band and connect distally to the knee. Up next is the greater trochanter. To start, you're going to find the iliac crest, and then from there you're going to work distally down. Then you're going to have the patient internally rotate their hip, and you're going to feel mass pop out. So once you have found the greater trochanter, on top of it is the trochanter bursa, but it's going to be difficult to differentiate from other tissues unless it's inflamed. For the gluteus medius, you're going to have your patient lying on their side. The origin starts at the iliac crest, and the insertion is at the greater trochanter. In between here is where the gluteus medius is, and you just want to palpate all throughout that area.
We're going to palpate the posterior superior iliac spine. If they have back dimples, it's just going to be right below that, but if not, you just follow the iliac crest down until you feel the end, and there's going to be two little bumps. And then from here, we're going to palpate the sacroiliac joints, and you just move inferiorly along this, and you can feel a little gap. And from here, we'll move medially, and this is below L5, and we can feel the median sacral crests if we move inferiorly down. We're going to palpate the ischial tuberosity and bursa, so you can have your patient standing with their foot on a table or laying down on their side with their knee bent, and it's approximately like in the middle, and you just kind of feel, and there's going to be a hard bony prominence, and then from on that there's also the bursa, but you can't really feel that unless it's inflamed. And from there we'll move laterally, and the sacral nerve is or sciatic nerve is right in between the ischial tuberosity and the greater trochanter, so like right in there. So we're going to palpate the gluteus maximus, and it starts at the glute line and it moves out down to the greater trochanter diagonally and covers the majority of the glutes. We're going to palpate the piriformis muscle, and it's from the middle of the sacrum to the greater trochanter. It's under the glute max, so it's pretty hard to palpate, but it's like right in the middle right there. We're going to palpate the hamstring muscle group, and you'll have your patient bring their leg up so you can feel the hamstring muscles. And from here you can feel that it goes all the way up to the ischial tuberosity, and it also goes down past the knee.